Hello, everyone. How's everyone been? We're back. It's been a little while since we've done one of these episodes, um, and hope everyone's doing well. Today's episode is about insurance, and this young lady sitting next to me knows quite a bit about insurance because she worked in the insurance medical field for a lot of years prior to having the kids. That's what she did for a living. So she knows a whole lot about it, and that has worked out to her benefit a lot of times. And she's gonna talk. She doesn't talk a whole lot in these videos. And again, folks, I know I've said this before. I'll say it again. These videos aren't scripted. We don't have scripts in front of us here. We're in our big fancy studio, our kitchen table. So if we, kind of stutter, repeat ourselves, but that's why, because this is just kind of like a casual conversation that you would have if you saw somebody out in the store or whatever. Yeah. So without without further ado, I'll turn it over to Pam here. Oh, and before we do, and we've been wanting to do these videos, guys, for a while. I got a whole list actually of topics that I want to talk about. And this particular one about insurance has been on that list for months, and we just are finally getting around to doing it. Now, obviously, the whole thing here with the United Health CEO being assassinated and the guy, and this is a very hot topic right now, and that's not why we're doing this. We've been wanting to do this for months. We're just now finally getting around to it. We don't ever have enough time. I don't know. It seems like we just, we're not doing the scrap anymore, and I'm working a different schedule, a lot less hours, and we still just don't have the time to do these things. But anyway, um, so violence is never the answer, folks. Although I know a lot of people are, happy about this.
Glorifying it.
You know, and trust me, I get it. I do. I watched my mother go through this shit with her insurance companies for years. And I mean, that poor woman would just be bawling, crying. And we're going back 30 years. This is before internet. This is before computers. This is before, so everything was done via mail. Everything was done over the phone. There was no online websites, any of this stuff. And my mother had a whole list of health issues, and my dad's insurance at the time sucked, and she would call these insurance companies up and these doctors' offices, and I mean, hours she'd spend on it. So I have a very soft spot, as it is for sympathetic, I guess, for people that hate insurance companies. Um, so I certainly sympathize with everyone out there that that feels you know strongly about this CEO being shot. But at the end of the day, I get it. The guy was a scumbag. Okay, probably ended up costing thousands, millions of lives. And it was all about profit and greed. But it's a human life you're talking about. Violence is never the answer. There are answers. That's what we're going to get into a little bit here. A lot of this falls on our elected officials, which I have about as much faith in them as yeah. So
Well, the big thing is with people who are glorifying him getting killed is these are also some of the same people that it doesn't really go with what they preach all the time. It's about how human lives matter and things like that, but you're glorifying.
well, yeah.
So, it just goes to show that sometimes, you know,
Um,
but
so anyway, insurance. It is a systematic policy of delay and deny. And I know a few of you is watching this here um, are in the insurance industry, so this is nothing against you personally, of course. But overall, and I've watched documentaries, I've read about this. Um, Overall, it's an absolute systematic policy of delay and deny. Okay, delay everything, deny everything. Systematic. And we know we're responsible for this debt. We know we're responsible for this bill, but we're going to systematically delay it. We're going to systematically deny it. if the person wants to follow through and push it in, a month or 2 or 3 or 6, maybe we'll pay, whatever. The hospital and doctor's offices in the meantime are threatening collections. But, you know what? If we systematically delay 10 people, 100 people, 10,000 people, and even, 1% go along with the other 95, 99%, whatever, go and, fight it, and we ended up paying, but we just, that 1% says, oh, geez, I don't want to get sent to collections. I'll pay this $800 bill that I'm not responsible for. The insurance company knows it, but I'll pay it. Because I don't want to, I don't want to do the legwork, or I don't understand my policy that well, or I don't want to get sent to collections or have, bad credit, so I'll just pay it. Then the insurance company wins. Anyway, I've talked long enough. Let's turn it over to this young lady. Get all her experience. So,
well, first thing is know what it's supposed to be covered, what you have coverage for. They used to send out paperwork that would show you, this was covered, this was covered. Some do, some don't. I keep everything like that because for me it's a quick reference. I can look and see. Make sure that, if you're going to have a procedure, I never ever trusted that it's covered, just because your doctor's office is ordering it does not mean that it's a covered service. So unfortunately, you are the one that has to double check. You have to call your insurance company and say, hey, is this covered? Is this doctor in my network? Okay, as long as you make sure that those things are all covered, then you should never be responsible for something that is a covered services. Back a couple of years ago, Eric had to have, it was his time for his routine colonoscopy. I made sure that the surgeon was in our network, made sure that the facility was, made sure the procedure was covered. So we got a bill for the consultation. It was a couple $100. Okay, we have a $35 copay. This should have been it. Well, no, lo and behold, the insurance company tries to send us a bill for the full thing. So I called them up and said, absolutely not. He's a covered surgeon. I'm looking right at it right here. Oh, okay, we'll take care of that. Most people won't. Most people won't call and figure that stuff out. So fast forward 2 months, he has the colonoscopy, and we get the EOB. And the EOB is an explanation of benefits. Every insurance company sends them to you, whether it's via email or via paper mail. It's explaining what you had done, what they pay, what you're responsible for, what's the doctor getting, blah, 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 blah. I go through them religiously because I have found so many times where they're incorrect. So we got a bunch of EOBs. One was for the surgeon, one was for the anesthesiologist, one was for the facility, and one was for the actual procedure. So coincidentally, it was like a couple $100 for the surgeon, a couple $100 for the anesthesia. Those were completely covered. But we get time, it comes up to the actual procedure, that's like $1,000. Well, lo and behold, they deny the
surprise,
one that's
denied.
The most expensive one.
Surprise!
So you're telling me that you can cover this, this, and this, but the actual thing you're not going to cover. So I had to call them up and explain that to them, and we'll take care of it.
Oh, well, our
because
fault.
they were hoping that we would just pay it. Second thing too is whenever you do call any insurance or any doctor's office, anything, always get the name of the person you're speaking with. And yes, people do give fake names. I worked with someone who used to do that, and I did not think that that was right at all. I did not like that fact because she was giving out she didn't want people calling and saying that, oh, well, so-and-so told me this, and then her having to follow up and back up on it. I did not like that at all. That's wrong. But always get the name. Sometimes they'll give you extensions. Even write down the dates of when you spoke with them.
Oh, absolutely.
Because there'll be multiple times that you will probably have to call, unfortunately.
And let me pause this right here quick, folks. Absolutely. You have to keep detailed notes. All right. Absolute. Physically write down who you spoke to, when you spoke to them, the time, the date, their name, their supervisor's name, what the conversation pertained to, etc., etc. Here's one better, folks. All right. Most of you guys watching this have got smartphones. I think pretty much everyone has a smartphone now. Go to your Google Play Store, go to your Apple Play Store, and download. There's several out there. Okay. Download a call recorder. All right, I have one. I've recorded all of my incoming and outgoing calls for years. All right. Yes, it's legal. No, you do not have to tell the other person that you're recording their call. You don't believe me, we're not going to get into the whole discussion, okay? Google it. 100% legal, 100% legit. You ain't got to tell nobody you're recording their call. Okay, you are fully authorized to record all of your incoming and outgoing calls. That's a fact. All right. Download one of these things. Keep records. Label them. What the conversation was about. All right. These insurance companies systematically, like I've said, you're going to keep hearing this, delay and deny, delay and deny, delay and deny, because they don't want to pay. They know goddamn well they're responsible, and they don't want to pay. And if they can get 2 people out of 100 to pay, and the other 98, fight and say, no, you're going to pay this, and 2 of them say, well, okay, I guess I'll pay, then they win. That's it. Okay. These insurance companies, it's all greed, corporate greed. All right, tell them about your mammogram.
Oh, so
2 years in a row.
I've had to fight 2 years in a row, and it's not just like one phone call or anything like that. It travels on for months and months at a time. It took me about 6 months to get a claim covered for my mammogram and ultrasound that I have to have because I have a family history.
Oswego Hospital, folks.
So
Scammers.
And well, so is also Blue Cross and Blue Shield,
Scammers.
who we have. So,
Scammers.
Excellus, so they're not any better. Took me 6 months to get it finally cleared up. I had one saying it was one person, the other one, everybody was blaming each other, saying it was their fault.
Nobody knew nothing. Nobody wanted to do.
They're saying, oh, it's looking like you were billed for 2 mammograms in one day. Well, why would I have 2 in one day?
Everybody does that, right?
It wasn't extra films. One thing is for me, and if anybody else is in the medical, I still have knowledge of codes and what they use and certain things that aren't covered and are covered for certain, if it's a diagnostic screening, blah 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 blah.
And let me pause you. And I love this, guys. I love it because Pam, 8 times out of 10, knows more about the medical field and the industry and the insurance and the codes and all this than the friggin' person she's talking to. She schools them on the shit because they don't have a clue. All right, she did it for years. Okay, these people ain't got a friggin' clue, and Pam's like, no, you're wrong. This is what's. Oh well, I love it. I mean, she's like a friggin' Wolverine on that phone. I'm telling you, yeah.
But it goes to, like I said,
it
goes back to what you know is supposed to be covered. Finally, I mean, I had multiple calls because I was getting calls saying they're sending me collections. Nope, you're not sending me collections. I'd call back to Blue Cross, and Blue Cross would say Oswego, Oswego say it was Blue Cross, back and forth, back and forth. So finally it came down to, we had a conference call. We had Oswego Hospital on the line, and we had Blue Cross and Blue Shield on the line. And we didn't, and again, remember, it is not the person who is just answering the phone when you call these numbers. They're reading from a script.
Yep.
So they will tell you, you're going to give them a problem, and they're going to pick, okay, let's go with
You're
answer
not
number
covered.
2.
Yeah.
Okay, we're going to go, they'll tell you that you're not covered. I say, wrong answer, what's your next one? You went over your deductible. I said, well, that's impossible because I don't have a deductible because we pay copays because we pay higher premiums.
They're reading off a script.
So they're reading a script. So what you need to do is you also, to get to a point, because they're going to give you the whole spiel, is you need to ask to talk to a supervisor or someone who else can help you because they are only limited to what they know.
Get one that speaks English.
Well, that's a big thing too.
Yeah.
So we had the supervisor who conveniently would not call me back anymore from Oswego Hospital because they didn't want to deal because they were supposed to pay for it. But conveniently, I had to go to her supervisor to get her to call me back, which didn't go over very well. But you know what? When I'm making phone calls and I'm wasting my time when we're paying a shit ton of money for insurance to be covered, we pay a lot of money through the plan for this insurance.
I pay over $800 a month.
Yeah.
Over $800 a month for my health insurance. Okay, for myself, my wife, and my 3 kids. Over $800 a month.
And luckily, knock on wood, we do not have to use it all that often. But when we do, there is always an issue with it. Yeah. And it's not like we're changing doctors. We're with the same people that we've been with years. Yeah. It's not like we moved to another state, nothing like that. It's the insurance itself. And conveniently, it wasn't a problem until the companies switched names. That's when it became an issue big time.
I don't know.
We don't know the correlation, but not sure. But anyways, so we ended up having to have a conference call with Blue Cross and Blue Shield supervisor and the supervisor from Oswego Hospital to finally get it cleared up because each one of them didn't want to take responsibility. And I sure as heck was not paying $800. A 3-way call. We had to do this.
I pay over $800 a month. And we had to tie up a two hours of our afternoon on a 3-way friggin' phone call between me, Oswego Hospital, and the goddamn insurance company. because nobody wanted. Oh, it's not us. It's not us. Lo and behold, guess what? Okay, what was it insurance? It was insurance or the hospital?
It was a mixture of both. Because the hospital was trying to was trying to double bill, which they couldn't do.
Scammers.
But then also the insurance company wasn't even paying what they were supposed to pay right out of the gate. Anyways,
scammers.
Biggest thing is I know a lot of people don't understand it. If you can find someone,
and that's what they bank on.
They find that you're not going to pay. I'm the one in whatever, and I know there's other people that will fight. That will stay on the phone and will do this and fight to get it paid because we know we're not responsible.
Yeah.
I know, like a lot of people don't. If you find somebody that can help you, I've helped Eric's dad out because with him, he's an older. So with Medicare,
they prey on the elderly. They prey on people that. It's no different than these mechanics. These shops, and you go in, you got some elderly person or a woman, particularly women and elderly people. Oh, well, you need new tires, Mr. Smith. You need new brakes because your car's not going to stop if you go to hit the brake. There ain't nothing wrong with the goddamn brakes and tires, but they know that if they get you scared, they get you scared. Oh, your car's not going to stop. Your car's not safe with those tires. They'll start writing checks for $1,000, $1,500. Okay, if they get you scared. These insurance companies, if you get them scared that they're going to get sent to collections, or these hospitals and these doctors, we're going to get, no. We've called the Attorney General not once, twice, and filed complaints. Okay,
against Blue Cross and Blue Shield because
two complaints against the New York State Attorney General's office. And it wasn't even just against the same.
It wasn't dealing with the same provider. It was multiple providers. Yeah. That it was. Let's see. We had issues with the surgeon. We had issues with VisionWorks. We had issues with the mammogram ultrasound.
Almost like it's a systematic delay and deny.
What else? We had other issues.
Almost like it's a giant scam.
And it wasn't just one provider. It's been multiple providers that are in the system.
Almost like it's a great big scam.
So biggest thing is, and I know it's a pain, but you have to do your best.
It's confusing, and they deliberately they make no mistake about it. They deliberately make it as confusing as they possibly can. They deliberately don't answer the phone, or they route you through to this person or that person or this foreigner or that foreigner. They want to make it as inconvenient as possible, as confusing as possible. It's all by design.
But so you give up.
So you give up. So you get pissed and give up and just
pay. So they get to keep their money
and pay the goddamn
and not
bill.
Be responsible.
It's all by design. Okay, we'll make it as cumbersome, as confusing, as much of a pain in the ass as we possibly can, so that people get pissed and just give up and pay the bill. And if we can get 10 out of 100 people to do that, then we're making billions more than we already are. I mean,
healthcare does need an overhaul.
You're goddamn right it does.
And definitely.
Yeah.
And yes, you do have the people that scam. You're going to have that from everywhere. You got people that scam. You got companies that scam. No matter what.
Right. And some this much defense of the insurance companies. Yes, you do have a lot of people out there that are scammers that are on disability and this and that. And
there's a lot of people that are on public things that we're paying for that don't. But
that it's a systematic delay and deny, folks. Understand your policy to the best of your ability. Know what you're entitled to. Know what's covered. Don't be afraid to call. Don't be afraid. The squeaky wheel gets the grease. Okay. Don't be. Download that call recorder. Keep track of your calls. Get names. Get dates.
And keep calling too.
And
if you don't hear back, keep calling. I mean, I actually called. I think it was my glasses because I didn't want to cover my glasses, which they've always covered. I even called before the claim was even in there because I knew it was going to be an issue, and it was. And there again, to never trust when they say that you should be all set until you actually see it in writing, until you actually get that explanation of benefits, or you get that bill that says there's a zero due.
Keep all your
because I've had that. Oh, you're all set, and the next thing I know, I'm getting something that I owe X amount of dollars, which I was told I was all set for.
Don't be afraid to call the Attorney General's office. That's what your tax dollars go for. Okay, that's what your tax dollars are going for. call them up, say, hey, I got a complaint with this hospital, I got a complaint with this doctor's office, I got a complaint with, you know, this insurance company, whatever. So, guys, stay safe, stay healthy. Hopefully you don't have to use your insurance. Unfortunately, you're going to have to at some time. Each and every one of us gets sick. Each and every one of us has medical procedures we got to have done. All right. Be aware, it is a systematic delay and deny, as you is become very public lately. Okay,
But
and
it's been like that for a
it's
long
been
time.
like this for decades, and it's getting worse and worse and worse. I mean, some of the rates these hospitals and these, you know, and the whole, you know, pharmaceutical, big pharma, that's a whole nother conversation. We're already at 20 minutes here. That's a whole nother conversation. Okay, some of these, you know, prescriptions are thousands and thousands of dollars a month. Who the hell's that guy?
Yeah.
That kind of money?
No.
Oh, Mr. Jones, we'll give you this heart medicine, but it's going to cost you $1,700 a month. You know, your insurance doesn't cover it. Come on, who's got $1,700 a month for one friggin' pill?
Yeah.
Really? You know, no, it's ridiculous. It's absolutely ridiculous. The whole system's broke. It's failing us. It has been failing us for a long time. It's only getting worse. It's getting to the point now where people are taking things into their own hands, going out, doing the unthinkable. Of course, that's not the answer,
No.
guys. Okay, violence isn't the answer, but you know, if we had a 10 million person march or whatever, and you know, demanded that this shit change, maybe something get done. I don't know. Anyways, guys, know what you're entitled to. Keep your notes. Don't be afraid to jump up and down, rattle your cage, because more often than not,
You're gonna be in the right.
you're not the one that's responsible. That's the whole point. All right, systematic delay and deny absolutely exists. Guys, we're going to do some more of these videos. This is this one topic. We ran a little over today. We try to keep these short, so we'll cut it off here. Be safe and be healthy.